Hello everyone, this is Dr. Mary-Zitta, and today I will be speaking to you about how pre-existing conditions, settings, and behavior patterns that predisposing to coronavirus infection, and how these behavior patterns and these pre-existing conditions can complicate a coronavirus infection. Now, we hear on CNN that over 500,000 American lives have been lost from coronavirus infection, and many of whom are people with pre-existing conditions. Now, millions of Americans have pre-existing conditions, and this virus is still going on. So we hear on CNN, people with pre-existing conditions are extremely vulnerable to this infection. But you with a pre-existing condition has not been properly explained just how your pre-existing condition predisposes you to coronavirus and how that can complicate the infection process. So today I'm going to be speaking to you. I would give you a list of some pre-existing conditions and explain the mechanism of how these pre-existing conditions predisposes you and complicates a coronavirus infection. So stay tuned and let's get started. Alright, so hi everyone. So like I mentioned, today we are going to be speaking about some pre-existing conditions and how that predisposes you and can complicate a coronavirus infection. So I'm going to start with some pre-existing conditions that we had already talked about. Alright, but let's classify it. Let's talk about autoimmune disorders that predisposes you to infections, not just a coronavirus infection, but any kind of infection, bacterial infection, viral infections, and fungal infections, right? Including parasitic infections. So autoimmune disorders, we had a glimpse of that last week, I believe. We talked about diabetes mellitus. We focused a bit on type 1 and then later on type 2. Now, we said diabetes was an autoimmune disorder where the body builds up an immune response against the cells of the same body. And the way we connected this process with an autoimmune disorder was that we said that the cells, your cells, goes and attack the cells of the pancreas, and that inhibits the production of insulin. Now, there are a lot of autoimmune diseases with that same kind of pattern, where the body attacks a system or an organ or a specific cell within an organ that secretes a hormone or something, and this causes for cell destruction, if not the organ destruction altogether. So people with autoimmune disorders are very vulnerable to infections, especially coronavirus infection. So diabetes is one of those pre-existing conditions. Diabetes is a pre-existing condition that makes you more vulnerable to coronavirus infection. Now let me just remind you real briefly. I know I mentioned this in my previous video, but in case you didn't watch it, let me just give you a brief synopsis of what I had mentioned. Because diabetes destroys the pancreatic cells, the beta cells that produces insulin. Insulin is not able to transport sugar from the bloodstream into the cells. So the cells are not getting the tools they need to create energy. And the cell that is depleted of energy cannot function adequately, cannot function properly. So these cells are very weak, such that if there is an infection, they are not able to combat that infection. So that is how diabetes not only predisposes you, but can complicate a coronavirus infection. So that is one autoimmune pre-existing condition that does not help a situation, a coronavirus infection situation. So the other thing that we are going to be speaking about here, besides vulnerabilities to coronavirus, another thing we're going to be talking about here, let's start with the children. Let's start with the children here a little bit. You see, people with cystic fibrosis. What is cystic fibrosis? Cystic fibrosis, I'll just give you a brief synopsis since we're not talking on cystic fibrosis today. Cystic fibrosis is when there's too much mucus production in the nasal region, in the throat, going down, and even the chest. So these individuals are very vulnerable to infections, all right, especially respiratory infections, because the mucus plugs, okay, it goes and plugs in where it's not supposed to, and it overly produces itself, such that normally the mucus is there to get out or to flush out the microbes that we inhale, right? But with cystic fibrosis, because the mucus production is so high and thick, these microbes, they stick in the mucus, and therefore they're not leaving the body. So they stay in the body because they are trapped in the mucus, and by staying there long enough, they cause a respiratory infection. So people who are already vulnerable to any other kind of infections with pre-existing conditions like cystic fibrosis, you can very easily contract a coronavirus. And that will complicate it, of course, because coronavirus is a flu virus, right? It's a flu virus, and it starts with the nasal cavity, the nose area. So when it enters the nose area, it starts in the nose, and then you feel bothersome, like something is in your nasal cavity and it needs to come out. If it's not flushed out at that time, it goes down your throat. That's where you start feeling the itchiness of the throat, like and sore throat. Now, that's because the virus is making its way down into your lungs, right? So you start feeling like you're having an itchy throat, or you're having a sore throat, of course, because the virus is making its way down, and then it goes down into your lungs. So in that process, you see that there is mucus production all the way down, such that if it's not taken out, coronavirus microbes get stuck in there, and it makes its way all the way down into the lungs. And when you get to the lung area where there's gas exchange, then it now affects, it goes into the blood, of course. And from the blood is transmitted through all the parts of the body and the organ system. And that's how you can get a heart problem that was precipitated by coronavirus infection. And you can see, so now you understand how a pre-existing condition of cystic fibrosis can predispose someone to coronavirus infection and complicate it with not only respiratory distress, but also have other organ system involved in the process, because the virus left the chest area through the gas exchange and went into the blood, and then from the blood you can see any symptoms down the line. Okay, so cystic fibrosis in children, when you have that, you want to make sure that you take extra caution because you are vulnerable. So the other thing we would like to talk about is Deja syndrome. So those of you who have Deja syndrome is when there's an underdevelopment of the thymus. All right, the thymus is underdeveloped. Why is this significant? It is significant because the thymus is rich with cells that are defensive cells that helps us build an immune response. So if the thymus is underdeveloped, it means that the cells that have to be generated and mature in the thymus are not mature enough. And if they're not mature enough, how do you expect them to build an immune response? So in Deja syndrome, the thymus is underdeveloped. And as a result, the cells that the body relies on for defenses are underdeveloped. And so not only are these patients predisposed for recurrent bacterial and parasitic infections, but they are also predisposed to viral infection. And with how easily contractable coronavirus is, these patients are particularly susceptible. And it can very much easily complicate the infection process. Okay? So cystic fibrosis, Deja syndrome, and let's also talk about sickle cell in young adults. Sickle cell is also another pre-existing condition that can predispose you to coronavirus and very much complicated. And the reason why I say this is because let me just give you a connection here. In sickle cell, we rely heavily on the spleen for the spleen to recycle a lot of pathogen, all right? A lot of pathogen, especially the capsulated pathogens. So, but in sickle cell, because the blood cell shape is sickled, it gets stuck in joint areas. It gets stuck in narrow blood vessels, right? It gets stuck, and as a result, it causes pain, in the joints, of course, and because blood is being inhibited from going through, because the sickled shaped blood cell is creating a wedge, right? Or it's creating a blockage, and then that results to pain, of course. But what also happens is that this sickle cell, they go and they clot the spleen, and the spleen is now functional because it is hurting as a result of the sickled cells. I will explain it when we do zero in on sickle cell anemia. In sickle cell individual, in sickle cell patients, the spleen usually is being removed, and the spleen helps us to sieve our pathogens out of the blood. So with the spleen being taken out, it leaves you very, very, very vulnerable to not only any other kind of infection, but also a coronavirus infection. So if you cannot fight a bacterial infection, and we see this a lot in sickle cell anemic patients, if we cannot fight a bacterial infection, how probable are your chances of fighting a viral infection? All right, not just coronavirus, also other kind of viruses. So you see that if you're susceptible to bacterial infections, parasitic infections, what more of coronavirus? So people with sickle cell anemia who do not have a spleen, they can easily contract this and get a complicated version of coronavirus infection. Okay? So the next disease, now let's just mention things real briefly now with the adult patients. I'll just mention one disease. So now we look at, for those of you with SLE, essentially in SLE, there is a decrease in a complement cell. Now this complement cell is also one of those cells that helps us to build ammunition against infection. So, but in SLE, which is also an autoimmune disorder, in SLE, this complement is in limited production. And because it is in limited production, the level of ammunition, the level of immune response is also immature. It's also at a lower level. That's why SLE patients are not only vulnerable to bacterial infection, but are also vulnerable to all the infections that requires ammunition from all cells, including complements, the complement cells, because they help you All right, the complement cells help you. They help you to combat infections. One of the infections that we see a lot are the Neisseria organisms, say like Neisseria meningitis and Neisseria gonorrhea, right? Neisseria meningitis and Neisseria gonorrhea. Let's stick with Neisseria meningitis. So Neisseria meningitis is one of those diseases, one of those infections rather, that you see a lot with pre-existing conditions that you see a less production of complement cells. All right, Neisseria meningitis and Neisseria gonorrhea. So these are some of the pre-existing conditions that predisposes you to coronavirus infection. And so let's take a break and we'll get back and talk about some immunocompromised settings and behavioral practices that predisposes you to coronavirus infection. So you stay tuned and see you shortly.